everyone. Hello, Manisha ji.
Hello.
Yes, we started the recording, so anytime you're ready to start.
Thank you. Right. Let's start today with the depression and the second session of the depression today. Last time I was talking about depression overall in general in adult and how it is connecting to the elders and how it is connected with the young generation. I'm going to take the children bit later, or first of all, let's take depression one by one, especially young generation nowadays, which is going up because it's a short-term depression, which I was taking it last time. I wanted you people to have, there are lot of remedies, lot of things. It's easy to say, I'm depressed, but it is not that. Always remember, nowadays, the working class, business class, in this life, the children, everyone has got one or the other way the stress and anxiety. They are full of anxiety. Any stress, any anxiety is bound to give you depression. And you cannot come out of that. I tell you about a work. I told you about it and how to come out of it. There are so many remedies, there are so many things which are there, which can bring you out in this whole, in the whole thing, whole issue, but we are the one who can help ourselves as well. Just don't sit by the corner and run and just cry, I'm depressed, I've got these problems and I can't solve it. This is a weakness. Find out why you are having that weakness, mental weakness or non-capability to absorb that external jerk is also one kind of the weakness that one has, and why it is causing. That is also there. So my question comes to every one of you. So today I'm going to take all the different therapies and different ways. How can you find and how can you solve this depression? Very, very important factor. Because in routine life, I have come across with so many people, they're sitting lonely in the house. They have got somebody outside. Now, remember emotions. People who are emotional people are bound to go into depression, into stress, into some kind of these anxiety or rush back problems a lot. It's surrounding as well. Second, it's your habits. Your habits, that's it. And this is present in the young generation. So, first of all, how can you come out of all this? That's my main question. So, let's take one thing at a time and let's go ahead with this. Let's take first a job and external environment, which is our day to day routine. Okay? Where you have a less money, you have a job today, you don't have a job, you are uncertain with the job, or you are very much stressed, or you are stressed with a target system, or you have to complete certain assessments or assignments, and then you are tensed with that. So, this is the part that you are facing as a day to day activity and a day to day life. That is going to reflect your social life, your personal life, your family life. And that is putting you into depression. Now, this is a short term depression, but it can go into moderate and it can go into severe as well. Now, the thing which is called as you are the self assessor and you can see how can you work on it. Suppose today This is a very important thing in the adult. Now, these adults are those who has gone in the childhood with some sort of a stressful conditions, or some sort of a vulnerability, or some sort of a social upbringing problems that we are going to have as a separate topic. But these generations have got something which is connected with the past. And they don't have that as energy. They don't have that power to resist this kind of a stressful position, which is called as, the strength and the powerful mind. They don't have that because while they were growing up, there is a brain which was on the verge of growing and showing some sort of a development. That development stage, which was shunted, which was blocked, or which was not allowed to develop very well. So such kind of an individual, they are bound to come across with this stressful position or with this anxiety, and resultantly, they can end up with the depression very quickly. That's the first thing you remember. Anything which is related, it's always been connected at one thing, that is your past. When we try to assess you, when I sit down to assess a person, I always take the past and I say, give me the complete report. Why? Because I need to know what is your past, what does it say, and how does it work. So that's the first. If you wouldn't have that, and maybe there are chances that your past is very well, there is something that is creating a trouble in you. So my question comes here that in such situation, in such scenario, either, especially a gents who has got some sort of lack of self-esteem power, that powerful, that strength of the brain is lacking. Then why it is lacking? Though you haven't gone through, then go through the tests. Or else, wait. Suppose you have gone through the job. I'm taking at this stage your work and external friendship and all that. You are going at a work. You have been bullied in the work, which is very, very common. The racism works. The people, they want to bring their own kind of own relative or own color or something. This is a very common factor which is internationally working. At that time, how can you fight this? Your mental strength, your weight, and watch situation, your calming down thinking to tackle the matter, everything. But this is not with you people who are full of anxiety, full of anger, full of emotion. These people, they are the first caught in this dirty atmosphere. And what happens? They end up with some sort of a trouble and resultantly with the depression. So my things are there for them. This is a beginning, and realize you have got a choice in your hand. At that time, it's your self-help which will important. Wait and watch the situation. First of all, any patient, they come to me, I have getting every day a calls. Dr. Manisha, please help us out. This is my work problem, which is a usual. Because now, today you got a job and tomorrow you don't have a job. Today you are out with that. Oh, this guy is harassing. I'm been given such a CV. I'm working hard like anything, especially in the metropolitan cities. Then, in that kind, what one should do? Sit down. They've done it. They're doing the duties. Let's think about it. Let's come and think quietly. Are you in a position to cope up with this situation or not? That's the first reply I asked them. You are supposed to wait and watch and see how the thing provokes and how the things are there, and give me the report. Because depression, just give a treatment on antidepressant is not the one which is there. You are losing your appetite, which is there. There are symptoms. I'm going to tell, I think I've discussed, but still I'll tell you that is happening. But this is the first stage. I'm talking about alcoholism and their problems as well. I'm going to take about the other things and their the problems. I'm going to take one thing at a time. But I want this youth to understand what happens when you go out in this stressful position. See, you are the one. Sit down, think calm and quietly. How can I take? When somebody comes, they do racism, this, that. Instead of that, take a glass of water, sit down, have a cup of tea, and talk calmly. Have a piece of a biscuits or something sweet or a cake and sit and think. Now, tomorrow, what's the position? Give the time, wait. But this, if it keeps on happening again, and again, then you have to help yourself that no, this is the situation. And then behind the curtain, you start working. The persons are like that. Am I in a position to tackle them? Am I in a position to fight them? Have I got some problems? Is it affecting my health terribly? Then how, if I go away from this, and if I quit the job, or if I quit this atmosphere, fair enough, because bullying is there. You ignore people who are trying to tell you any nonsense rubbish. But am I going to accept this rubbishness any longer? I've forgiven, but am I there to do it any longer more? Or can I do it more? Can I bear it more? This is your mental tolerance that you have to generate. And for that, you have to guide and get a self-guide from the therapist, which is, there are booklets. If this kind of a position happens, to avoid the depression, what you do? Sit down quietly, calm down quietly, do some yoga, or don't talk with anybody. Go in the room for 10 minutes and think about it. Come back and start the job. And if you can't stand, then you go for the online doctor help or a cognitive therapist help. This is a temporary. Cognitive therapy is not just a one. Or else, to come out of that atmosphere, do something which you like it when you come back home. But if you can bear it, okay, fine. This atmosphere is just a temporary phase and I can get away with it. Then this is very important for you. But you can't get away with this kind of atmosphere. Then you go for the cognitive behavioral therapy, where there are basically what happens at that time, the GP say, okay, fine, you go for this, and they will guide you about it, which is a basic. A general online sessions are given, 5-6 sessions are given, and they try to, this is like a self-help, that no, you try to help yourself in this way, do something which you like it. This is because they are understanding, the cognitive therapists, they understand your basic trouble is your job, which is known that this is a usual, it is in general, and everybody is facing. So they will tell you that. That is, even I suggest that, okay, fine, go to the therapist, that's fine, you will be out of it. Then another thing which will be suggested you is to have the full-fledged dinner. Number 3 they tell you about is the vitamins, deficiencies, and to work on the deficiency, do the testings done on that. Because these are the basic, as I tell you, They're the connective link to put you into this situation, like a thiamine, like a vitamin B12, like a folate, like so many other things are there. These are the deficiencies where you can dietarily or you can work on that because you are using your body, your chemicals in the stressful position. And that's why you end up with the short-term depression. I will never allow my patients to go ahead in depressive treatment or antidepressant unless and until it is very, very important. I wouldn't like it. Why you want to fall into that horrible therapies? Secondly, so that is a first. Then if it doesn't, if the problem remains unsolved or you can't solve that, then better start with the second is the exercise. No, better start doing some exercise as well. When you get some sort of a baseline clear or something, then walking, working for a working, working in a way that go out. You have to make because you are not within you. You are just covered in the room or in that you don't talk with the people. You are like an irritable person. You get the irritability or you start crying, you get touchy, you are trying to, these are the symptoms that when you start feeling it means you are crossing the line that you can't help yourself. That time what to do? Bring yourself out from that atmosphere. How to bring out? Go in the morning, walking, do something which you like it, and come out of that environment. If somebody tells you you are black or you're white or you are like you're rubbish, you're just like a dustbin. Okay, that's a thing that they say you, and they try to degrade you, which is not acceptable to you. And this is like a bullying to you. So you are getting that mental problems, anxiety, stress, irritation, anger. These are the loads of emotions that develops within you. And that is why you are getting this kind of, and you try to get away with it. No more, no more. But then how to come out? You've done enough. You have done the cognition. You have done that. You couldn't get away with it. Next step is walk. Come out of that atmosphere. Anybody tells you, get up from the table, go in. Tell them, don't talk to me like this. I'm not used to it. And don't make use of it. That's the way. Secondly, that's a simple, but calmly. Please, I'm not used to it. You don't say this. Or secondly, there are exercises. Second, other way around. And then go out. Give me 5 minutes. I'm coming back on my table. I'll try to cover. Leave that atmosphere. And when I come back, please don't do this. You want this? I'll try my best. Don't give the final answer. Try, shall, don't say will. Give the probability. Shall, will, try. These are the best things that you can do. I shall try. I shall do. I shall maybe, probably, I will. But don't give the confirmation. That will give the opposite individual work, or it will give them something which they can sit on your head. No, that's not right. Number 3. Number 3 you can do is the exercise. Exercise for the depression is go out for a walk, freshen up yourself, have some gum, cake, or some tea or this, that, sit down on the table, complete your work. The same thing happens when exercise. If you are fit enough in the morning, go for some kind of a yoga. Go out in a sunrise, go in the morning, and sit down. In the morning, yogas are better. We do in Arogyam, we do the yoga sessions and all that. But I tell you, pranayam, which is like, nose and all that, that's kind of a yoga, which is very important. It's simple. It's just like meeting your exercises, releasing your breath and taking in the breath. It's just a very simple, but that is going to give you mental calmness. That's the exercise that you follow. Secondly, some people are in a mood of, say, like jumping or some jogging. Do that. There is nothing wrong. That will enhance your body's exercising capacity. It will enhance your transmission activity. And then, secondly, is a talking therapy. When you are, that's your internal factor. You are not, you don't have any other paranoia or anything. But to come out of that, you can talk. Talking is what? You talk your problems with a doctor or talk to somebody who can understand. And that is making you to bring out your internal agony towards the things, your frustrations. And that may bring you out from certain kind of your internal, like emotions. And believe me, this helps us. We apply this talking therapy a lot in bereavement, in external, like a people in the society, in the around, say, people around in the work situations when they get the depressions and all that. We tell them, tell your things to us. We are there for you. In that way, we apply for the talking therapy. At the same time, we tell them that you tell your sorrows, and if you are a bit relieved, then we will put you to something and we will guide you for something where we can give you counseling service. On your ground, we try to find out why we have this and we can give you counseling. Counseling means how to bring it out. These are so many ways that we are being taught or the therapists are taught that we can bring it out. This is called as a talking therapy. The talking therapy are loads of kind. Like, we people, when you tell us, I had one patient, I give you a very simple example, who was telling me that, this is the benefit I have got with the job, but I haven't completed. I'm very much depressed. And today, because I couldn't complete, they are just sitting on my head to complete the target. I have to complete this much amount of target with the people. And then the person gets depressed. I said, don't worry. Ultimately, what will happen? They will tell you to say go and goodbye with the job, or they are not going to say goodbye from the job. That's very important factor because it's a bread and butter scenario. They can't tell me I may have to change it something. Okay, fine. Better change. Accept. Then the proud comes of the person. But I'm so qualified. Why should I change from upper to lower grade? I said, you are not changing from upper to lower grade. You are not changing your experience. You are changing from one department to another department. And you can get a new experience of that department. But at the end of the story, you are not going to face such individual. And keep on telling us what's happening in the department. So we know how does it work. Then the doctor has also got certain authorities within their hand. But at the same time, my question is, there are kind of the advices, there are kind of the talking. But if you don't tell your trouble, if you just try to suck and seduce, you just seduce yourself You just try to, you're just keeping your things within you, then it won't happen. And our job is to, that is called as a talking therapy. Then we ask you multiple questions. This is a kind of a talking therapy. We try to help you out. And I've seen many people, I've seen many people who has come out from these kind of the talking therapy. This is, and even it is available by NHS, any psychiatrist, there are nurses, they try to work out. They try to tell you, don't worry. I have seen a very simple thing. Some people, they need, a simple pampering. Don't worry, that will come back to normal because they've got no one. That's a loneliness. So that's where people are feeling, I've got no one to do for me. I'm just alone. This helps in bereavement. This helps in the job scarcity criteria, stressful position, target system, external environment. Secondly, this therapy is very helpful for us when there is a family problem. Family, yup. That's a social. And there are people at that time, this talking therapy works a lot. So I would rather suggest you all guys to work on this. And they are the one, that's a one where we people come. Now come, if it isn't helpful to you, then there is another therapy that we work, is we combine. We take your sorrows, we take your things, we take your details, and then we try to work with the talking therapy. We try to work with the commitment therapy, with the multiple things, because there are loads of programs which are there, and we try to work on that. But at the same time, we have got other things. So in a young generation, we have got so many things with us. Sometimes it happens that we might have to give you some antidepressant for the timing. We give you that you come out of that particular sorrow, particular emotion, particular thing, that yes, now here person had gone enough. Like you are having a stressful position from past 3 weeks, 4 weeks, 5 weeks, 8 weeks, or say from past 3 months. And then what happens? At that time, you start taking into unusual, unwanted things which you should not. Then that is the time. It is a doctor whose responsibility is to treat you for the timing. And then they definitely give you some antidepressant for particular small span of a time. Otherwise, it's not like that. And they equally put you through these kind of a talking therapy or acceptance commitment therapy, where there are a lot of programs which are there. Family, integration, healthy working, then one-to-one talking, it's a group talking. So, you try to resolve your problems with the group of the 7, 8 people who are like them with you, or individually tackling the problems, and they work. So these are the things where we have got a lot of things to do. And at the same time, so with the antidepressant, we give you these kind of a non-pharmacological treatment. Now, these are very important. That's a combination of the treatment we try to give it to you. These treatments are very important when people, they come out, they are ready to tackle the external severity. When your reports are normal, when you are normal, you don't need this. So at that particular time, we try to give you the combination of the cognitive behavioral therapy and the antidepressants, like some of the SSRIs or some of the very simple, which is very much necessary. Then we try to work with the certain assessments during this era. Once when you're out, we work with the assessment eras. Today, I must tell you, I'm taking this part because last time I think I've discussed quite a lot. So I'm taking more on the therapeutic side. And I'm going to tell you next time about this substance abuse with this therapeutic. How does it work? Because it's a work and surroundings and a social. This is a work is one part of a social, family is one part of the social, your surrounding is one part of the social, where you cannot, whether you can come out of these problems or not. Second comes up as your interpersonal, how you are relating, what are your problems, your relationship with the people. Are you finding difficulty with the communication? Are you finding coping up with the situation in the work? Are you finding difficulty in coping up with your family, maybe your wife, or maybe your, like we people are with so much of a trouble with the children, or children are like that, or these are like that, or everything, like everything comes one after the other. Or then what happens? We sit down with you. It's like, and we give you all the sessions. Now in this, okay, your children are, because it is mainly, it's age gap, a young generation and that elderly individual, the age gap. But always remember, the elderly has got its own trouble, young has got its own trouble, children has got its own trouble. So there is a age gap, era gap, thinking gap, educational gap, surrounding gap, and that is being filled up with the perfect a relation, perfect talk, perfect sessions, and educate the young against the with the elder and younger. So many times it happens that they are not much aware about it. They just think of their own. I have this, I should do. And that's where the clash happens. So, psychiatrists, therapists, their jobs are such that they try to work with this and they try to create a healthy relationship within this. They try to create a healthy bonding in between this. And that is essential so that you work, you understand, oh, yes, this person is like that. I have to behave in this manner. Like a very simple, there are people who always think about money. They're money minded. Oh, in this 1 hour job, I've lost my £1,000. With this traveling, I lost my time. And you know how much I lost? If I do this, I lose my £100. They talk of money. You understand? And if it works with a family, their work comes, oh, this works so much. If they think of, I've seen many of the uh, foreign people, they go to the foreign country and they think of the euro and they think of the pound, they come the US dollars or the bahts or other currencies difference, and they try to evaluate and combine, or they try to compare with it. This much baht, means it's a Thailand currency. If I'm spending this much baht, it works out to be this pound. That's where they try to compare in between. So these kind of individual, it is called as, and this young generation, they don't bother. They said, oh, what's wrong in that? What's a big deal? What's a big deal with it? You can do easily. Why are you bother? So that's the argumentative. That's again the anger. That's again the tussle. That's again the problem of the depression. So either The young is really keeping himself depressed, or they go away from the family, or they depart and they try to work in a different way. So this is called as a personal relationship, which is being cut off in so many ways. And there are there are nearly 8 sessions, 10 sessions, 16 sessions, 20 sessions, people they do take with the P, and then they try to create a relationship, bonding strong. That no, these are the people, they will not change. You have to change. How can you change? Ignore. How can you do this? This is a psychologist's job. They try to work. Psychiatrists also work towards it. They all are creating a relationship therapy, which is called as a interpersonal relationship therapy. They make them sit down. Even not only that, the affected individual, the young generation, they have got the severity, like the job, family, wife, because nowadays the wives are also ultra modern. In basically speaking, for them, the elderly people, they are just the rubbish of the dustbin. That's what they think. And they sometimes, I've seen the people, my wife, she said, my parents, how many dustbin you have? The elderly people are considered as a dustbin to my parents. So, I've heard them talking about. Well, everybody is not like that. I'm sorry. I have to use this because I've heard that. Everybody is not like that. But this is it. And that's the emotion which makes them to realize. So what my question comes, it's the relationship, it's a bonding, understanding, lack of education, lack of living. That is the filling the gaps. And that gap is being filled by this therapy. And that will make you out, bring you out. Till then, for the timing, there are chances, because if you have gone up little above on the depressive condition, we give you treatment. There are medications, SSRIs, which we give you. So make you to work in a better way. But then this therapy is very important. Then we see about the behavioral problem. Your behavior, that works totally on the assessment side. How much we assess you. We assess you that what sort of a thing happened in the past, what is your thing, how you are, why are you doing this job, what is it? You say, I'm okay, fine, but we test you by talking to you, by giving you some sort of exercise, by some sort of some way we try to create some scenario, and we try to guess, we try to judge you. Then we try to take your past experiences and past events as well. And we see there are loads of ways that we can judge your behavioral concepts. And on that ground, we try to recommend that, yes, you have got the problem with the depression, with the anxiety, and you might be facing this like a fibromyalgia. When we people in Arogyam, we are taking it, we try to take the assessment of your past, and we have found abusive cases have got these problems. It's not just a body ache or arthritis or nothing. It's a fibromyalgia, which is very, very rare, and sometimes it's very difficult to come out. The medications wise, it's very rare. So these are the things we have to work on it. And then once when we find that behavioral, your behavioral changes because of our work, then we say, no, now this is a time we have to put them into sessions, or we have to give them the antidepressant for the time. So that's how. Okay, you got a GP, go ahead. If the GP says, no, I have already done that, you better go and get the services from psychiatrist. Psychiatrist always first take. Nowadays in NHS, it's easy. Antidepressants to write it down, to get away from the job very quickly. But in my time, because certain psychiatrists, they don't do that. They rather take a longer time, but they try to work in a better way. In this, Antidepressants are the quick ones for a longer terms. Okay. Sometime I said in a behavioral cases, we try to work. We assess you. Your behavioral, are they? You behave because of this, or you have got anxiety problem, you got the stress problem, or you got the family problem. What? Why? And we work out. So that's your things. That is a behavioral kind of a thing, which will put you into a depressive situation or depressive position. That's a one kind. Secondly is an individual problem solving. We work one-to-one, which in Arugim we do it one-to-one. Sit down in front of me. Tell me what's the position. You go at that time. This is, of course, it is identified because sometimes you depressed and you're confused, because confusion is a part of a depression. So you're confused and you give a vague stories. That vague stories, it's a multiple things that you try to combine. Oh, I went that, and then it happened like that, and then this is like that. Then there's something, in the past few years ago, I had this. So, that kind of a vague history that when you give, what you do, it's like we combine. We come up with the bottom line. We come with the perfect line. That's a psychiatrist's job. And then we try to treat you. But this is totally non-pharmac, because we want you not to take more of the antidepressants or any other treatment except non-pharmacological. We put you into exercises. We try to tell you about some of the adjustment or a family, or loads of things are there that we try to put you. Unless if you have got a severe or a moderate depression. One-to-one, we find that here is a person who is definitely severely affected. Then we say, please, we might have to give you some treatment, and then you can come out of it. So these are the kind we suggest and we assess. So that's a one-to-one phase, where when you give a multiple, we need to find the bottom line. This is not the right way of come up. So that's a kind of a therapy which is there. And we try to go through this. Now, certain kind of the therapy where you have got a very, very big troublesome relationship problems, which are like a man and woman, or a child and a person, adult person, or you have got the trouble with the husband and wife, or a parents and it's a social, even in the work also this is like that, or around where you are not mixing, you're sitting quietly, you're like that, you're like a self-center, you get stressful position where you get stressed up very fast. So in those kind of a situation, we recommend sometime, we try to sometime put you, and we try to see how it is, because it's not like that. Some people, they get depressed quite often. When the wife says, they get depressed. When the children say, they get depressed. And they try to sit by the corner. Some people, they get angry very fast on everybody. They get blasted, they get hysteric. That is also one kind of a thing that they show. It's like a diversified, it's like a volcanic or a fire behavior. That is also happening. And that happens when you have got an unbearable, stressful position. So my question comes there. At that time, we try to work out. And we put you on a long-term psychotherapy. Long-term means it's not that long, but okay, like say maybe 2 to 3 to 4 months of the therapeutic actions. That here you are. And then not only them, we try to make sure that it is applicable, which is a psychologist's job. At the same time, we tell even the family as well about the feelings, about the emotions, about the things, about the surroundings. And this is how, this psychologically, we try to correlate every problem, put them in a sequence. Oh, first it happened with the person like that, so they were abused, then they had the family trouble. See, when you have got a series of trouble, it is very difficult that you give us a vague history. And I've seen, doctor, but 4 months ago, I had this incident as well. Doctor, the 3 months, when I was 12 years old, I had this. So, what we have to do? We have to frame them. We have to put them in order. And then we tell them that, yes, you got this and we are there for you. We want these people with you, or we would like to talk to them individually, if you allow us. And then we put them into counseling, we put them into so many other help that is there that can help them out. Or we put them into couple therapy. Couple means the father and a son, or a husband and a wife, mother and the father, and the son. It's like the grouping them. And we try to tell them, and we give them the homework as well. These are all the different ways how your depression could be minimized. This is the best way to work. Of course, they need time, because there is a lack of understanding. There is a lack of cooperation. Even at a work also, the psychiatrists work. We people, we talk to the boss of the company too. That, sir, please, the person is like this. He's under my treatment. And then sometime we have to use our power as well, which we are given as a, just excuse me for a bit. I just. Now, sorry about it. So we always try to work with power. At that time, we have to work in that situation, and we have to do. So think about it. These are all the kind of the treatment that we can give, which is a non-pharmacological. And then we work on the counseling. That, yes, you need this. Legally, you can do it. There are loads of ways. But because you are depressed, because you are in such a position, your mind, your thinking, your confusion, and your mental stability, it doesn't work. And when this is applicable, when you say, I said, wait and calm down the situation. When you can't cope up, when that waiting and calming and seeing that situation that is a time and the era you pass through. You went to GP and that has also gone through. You have done some GPs, go this exercise, this, that. That era has also gone through. Then GP says, now better go and meet your psychiatrist. At that time, you come up with a little up level that you can't sleep, you're confused, you can't think, your power, your work, your thing, your day-to-day life, your everything. When they start getting affected, the cognitive therapists, they come in a picture, they try to work on you. Okay, you go out and give me the results of this. And these all the sessions, they come, these are the longer sessions. Because depression is a long thing. Now, think about all those parts and we can work. Depression is supposed to be covered up, and we give a long sessions for this patch. That's a couple patching up, like, talking, group, these, and we give a long time for that. You can call it as enough 3-4 months to adjust, to put you down. Anger therapy, to put you down from the anger so that you don't fall into depressive condition. So there are a lot of things that we can work and we can do. So my question, antidepressant comes as a last. After seeing the severity of the symptoms, we come up with the antidepressive treatment, And we first start with the smallest dose. That is for just a couple of weeks. And if you don't show the improvement, if you don't show like a 72 hours, first we do, that is when it is above. And then sometime, if one antidepressant has got some trouble, we try to combine together. We give a combo antidepressant that can give you some betterment, or your symptoms are relieved and all that. But that is when the symptoms are severe. It is not necessary. Every time you don't have to have that. And sometimes we tell them as well that this antidepressant will give you these problems, these are the side reactions. And if you start showing some very severe, some people, they don't show it at all. And some people, they do. And these are dangerous. Then we try to switch on with the different, but only for the time. And then come up with the non-pharmacological. But if you are getting back into non-pharmacological treatment, and if you are getting back to the regular, you also have to help yourself. That I want to be out. It's not just the psychiatrist. Even you people are responsible as well for yourself. It's a doctor who can help you. As a psychiatrist, I can help you. As a practitioner, I can help you to bring you out, to put you, to give you the ways, suggestions. I give you like it's like a commitments. I look at your commitments, how much committed you are. But you as a patient, you also are responsible. That yes, these are the things which is so important for us. It's not that it is easy. The antidepressants, there are loads and loads of things. And then once when you leave the antidepressants, there are symptoms of leaving the antidepressants. This is called as a withdrawal symptoms of the antidepressant treatment. That also we tell them that this will happen. This is going to happen with you. This is going to be like, so you have to, the best part is always remember that depressive condition, when it starts, it is better to control in the beginning. Keep a mind full, like attention to present moment, this, that, and work to solve that. But do not try to keep within you. Go and talk, get lost, finish with it. So, your brain doesn't keep on getting on and on. But if you have got that thing of the old part hitting you again, then, okay, today they have come, you're okay with it. But don't allow it to repeat. Don't allow it to come again and again. Don't get yourself full of anxiety that you get troubling, you get panic, your hands start shivering, your mind get confused. So there are a lot of things, and that is very important. There are Ayurvedic treatment as well. That which is important. Sometimes it is good, but there are few that don't go for these. Sometimes that I wouldn't say don't go for it, but there are some of the Ayurvedic treatment or a herbal treatment which are there. They may have some enveloped side reactions or a side problems. So that is where, if you're not aware, don't go for any of the treatment by yourself, but operate and go straight to the doctor or recommended person. So many times we have given certain stimulation therapies. The brain, their brain doesn't work well. The brain transmission activity, neurotransmission activity doesn't work. Then we try to stimulate the brain. which is called as a stimulation therapy. But this therapy, when we give, when the person is in a severe depression, like, it is, it's like, we find out, we take the EEG out and we try to work. There are a lot of things that is there. At that time, we try to give them the therapy, the cranial nerves, and then that nerves become activated, and how activated. So there are a lot of things that is, and these kind of nerve stimulation or electroconvulsive therapy, all those things which we try to work. So work out in this case and see how it is. So my question is with you all people, that don't take depression as a simple therapeutic things. It is treatable, but try to understand, give some time and make sure that you all come out of it. And we are there to help you. Any of you has got any question, I would now rather say we will stop with the recording so that we can take the things further. May I request the host to stop the recording from that end so that they can ask, or anyone has got the questions, they are there to ask me and send it out to me.